EMG question of the day. Which statement is not true regarding the presence of complex repetitive discharges? A. May or may not suggest the chronicity of the underlying process. B. May occur in normal people. C. Exclude the possibility of a myopathy. D. Occurs in patients with Schwartz-Jampel syndrome. The condition addressed in this question is called complex repetitive discharges, but it has been called bizarre repetitive potentials and pseudomyotonic discharges. I think the three names have one thing in common: they are mysterious. I will start answering this question by asking you that when you look at the next frame, not to read it, but only to pay attention to the sources. A table from an article written by Dr. Rubin and a segment of a table from Dr. Kimura's book. I ask you not to read the prior frame because in the next few minutes I will enumerate and make some brief comments about the diseases listed in these tables. We will first address neurogenic disorders. This diagram shows normal spinal cord and muscle histology, and the spinal cord and muscle histology associated with motor neuron disease. Here, in the normal cord, you can see neurons in the anterior horn surrounded by white matter. Here, you can see white matter, but as it is characteristic of amyotrophic lateral sclerosis, there are no neurons nor signs of inflammation. Here, you have normal muscle characterized by relatively consistent size, angulated muscle fibers with peripheral nuclei. Here you see characteristic of ALS, loss of angulation, and group atrophy. Other neurogenic conditions associated with complex repetitive discharges are chronic radiculopathy and chronic axonal loss neuropathy. Compare the colorful normal nerve with the paucity of color in the abnormal nerve. Muscle disorders associated with complex repetitive discharges are 1. Inflammatory myopathies such as polymyositis, characterized by endomysial inflammatory infiltrate, invasion by inflammatory cells of relatively healthy muscle fibers, and necrotic muscle fibers. 2. Acid maltase deficiency. Acid maltase deficiency is characterized by a vacuolar myopathy. As you can see, some of the vesicles are empty and some filled with acid phosphatase positive material. Periodic acid shift staining in this condition will show diffuse or patchy increase in muscle glycogen staining, as you can see here, pointed by the arrow. It is worth noticing that PAS is not glycogen-specific stain. It also stains glycoprotein and proteoglycan. Acid maltase deficiency is also known as Pompe's disease and glycogen storage disease number 2. 3. Myositis with fiber splitting. The splitting is easily noticed here. 4. Duchenne muscular dystrophy. Duchenne muscular dystrophy is characterized by excessive muscle size variability, round fibers, and internal nuclei. Connective tissue is increased. 5. Inclusion body myositis. Here you can see an inclusion body and here another one. 6. Hypothyroid myopathy. Hypothyroid myopathy is characterized by type 2 atrophy. Notice the sparsity of dark fibers compared to the light fibers. 7. Schwartz-Jampel syndrome. Patients with Schwartz-Jampel syndrome have a typical face that you see in this frame. This characteristic face is due to continuous facial muscle contraction. They are short. This condition is also called chondrodystrophic myotonia. Can complex repetitive discharges be found in normal people? The answer to this question is yes. Muscles cited with incidental complex repetitive discharges are the biceps brachialis and the iliopsoas muscle. Now I will present you with conflicting information. First, in Kimura's book, it is stated that some complex repetitive discharges studies have shown their association with chronicity, while others have not. And secondly, a study in 2003 looking at the positive and negative predictive value of complex repetitive discharges, as you can see by checking out this column, showed that positive predictive value of complex repetitive discharges is low for the diagnosis listed here. Yet the negative predictive value is so high for motor neuron disease and myopathy that the absence of complex repetitive discharges in a patient suspected of having these conditions should make us consider alternative diagnosis. So the answer to this question is C. Thank you very much for your attention.